ICSI stands for intracytoplasmic sperm injection. To put it very simply, what we are doing in an ICSI cycle is taking the female egg. Now the female egg is surrounded by a hard protective layer called zona pellucida, making a hole through the zona pellucida and picking up a healthy sperm and injecting that sperm into the egg directly through the zona pellucida with the help of a needle under a microscope which magnifies the egg as high as 500 times. ICSI, IVF, they all share same indications. The purpose of IVF and ICSI is to cause fertilization or formation of an embryo in women who are not being able to form such embryos. So people who have tubal damage, people whose eggs and sperms are not coming together or fusing to form an embryo are the best candidates for this. The extra advantages that an ICSI has over a conventional IVF is that ICSI can be performed even with very few sperms or sperms which are retrieved from the testes of the male partner directly, because we are injecting the sperm directly into the female egg, as opposed to an IVF cycle where need at least 40-50,000 sperms per human egg. Here we can get a fertilization even if we have one sperm per egg. So this is a fundamental difference. There are other indications also. Nowadays we are also forming embryos because we want to form healthy babies. Now to detect whether the babies are healthy or not, we have to do a procedure which is known as pre-implantation genetic diagnosis, where we take out cells from the growing embryo, find out whether their cells are healthy or not, and then only transfer the embryo back to the female womb. Now this process is only possible when only one sperm is in contact with the egg so as to form an embryo. This is why we do an ICSI in cases where we are doing advanced techniques such as PGD or PGS to detect the health of the chromosomal health of the embryo. Other than that, there are other indications also. There is a condition which is known as molar pregnancy, where one egg is penetrated by 2 or 3 sperms together, which leads to an unhealthy pregnancy. In these cases also, injecting one sperm into one egg will ensure that the DNA component of the growing embryo is better and is healthier. The sperm into the egg. So if the sperm and the egg are both mature and healthy, then fertilization is bound to happen. So we would say that the fertilization rate is almost 100% where ICSI has been used. We have to understand that in natural method, what is happening is thousands and thousands of sperms are traveling up the female reproductive tract and then coming in contact with the female egg. So there is bound to be some sort of a selection that's happening amongst these sperms, and hopefully the best amongst the lot has been selected by the oocyte or the egg to form an embryo. ICSI essentially has been offered to couples who are not getting a pregnancy primarily because of male factor infertility, that is, when the sperm defect is very high. Here what we are doing is we are trying to identify a healthy looking sperm and then injecting into the egg to hopefully get a healthy pregnancy. But sometimes looks do not always give you the full picture. So even if the sperm is looking healthy, there is no doubt that there is a higher chance of miscarriage or abnormality in the child in process of ICSI, because essentially we are dealing with sperms which are more damaged than a normal population. ICSI is now the standard option for severe male factor infertility. In IVF or in ART procedures, we can get a pregnancy even if we have 40-50,000 sperms. But for patients who have even less than that, ICSI is required, because technically one sperm injected into one healthy egg can give us a pregnancy. But we need to remember that sometimes, or in rather most cases, ICSI has been performed where the sperm count and quality is very severely compromised. So ICSI on one hand is giving a promise of child to people who were previously considered infertile, on the other hand may have increased the risk of having miscarriages or congenitally deformed children in some other couples. Nowadays, a better technique has been promoted to possibly bypass the side effects of ICSI. That technique is known as IMSI or IMSI. Morphologically selected sperm injection. So what does this mean? In ICSI, if you remember, we were magnifying the sperms 500 times before we injected the sperm into the egg. In IMSI, we are magnifying the sperms as high as 7,000 times before injecting the sperm into the egg. So sometimes we are able to pick up intracellular damage into these sperms and therefore prevent the miscarriages which were happening with ICSI. It is a very promising new technique. More data needs to come in, but then IVF or ICSI is always an evolving science, and maybe IMSI may give a solution to questions that have not been answered with ICSI.